afternoon to the first nursing in-service at Prairie Vista Village. We're glad to be here. So my name is Carol Hillebrand. I'm a nurse, account manager for the pharmacy, the Ankeny Pharmacy. And I'll introduce, Carol when she gets back in, because she usually does the first part of this. But Rightos Pharmacy, we have our pharmacy, we have 2 pharmacies in the state of Iowa, one in Ankeny, one in Cedar Rapids. So all your residents' medications will be serviced out of the Ankeny Pharmacy, which is where we both work. So I'll let you do your opening.
Yeah, I'd be happy to. I'm Carol Whipple. My technical title is marketing and sales. So you'll see a lot of me kind of during this getting us going process. And then I have the unhappy title of med cart person. So if you have med cart issues, I'm usually your girl. That happened by fluke. That was a good lesson, and don't get good at things that you don't really want to be involved in, because that's how that happens.
You get signed up to do them.
Yeah. So, and then contracting, the therapeutic interchange program, some of those things, I'll be involved in those as well. So we are out of Ankeny, as Carol said. That's actually our headquarters. That's also a warehouse for us, so all of your meds will come directly from our store in Ankeny. We aren't having to bring them in from a bigger city to get them to you, so our response time is really quick. So we appreciate that about Rightos. We're owned by Rocky Anderson. He has been a pharmacist in Iowa for a long time. Well, not a long time, he's younger than I am, I shouldn't say that. For a while. And he's been in long-term care for about 12 years now. So he used to do retail and long-term care, kind of figured out along the way they're very different, and he wanted to own one and do it well. He has a passion for geriatrics, so does his wife. She's geriatric certified, she's one of our consultant pharmacists, and they decided to stick with the long-term care route. So we do long-term care facilities all over Iowa, really. We do almost all the hospice in Des Moines, most of the behavioral health around central Iowa. So we work with a variety of clientele, but everybody's sort of in the same boat as you guys, as they have residents that they have to serve and get their medication to them. So he's really big on medication management. We like to talk about initiatives like reducing med pass time, help you guys figure out some of those things. He's very innovative, which can be exhausting when you work for him, but it's really awesome when you're a customer of his, because he's always on the forefront of the technology that's needed, and just any new ideas. We're also part of Guardian Pharmacy, which is a nationwide network of pharmacies. But I say it's kind of the best of both worlds. We own and operate locally. We're partnered with Guardian nationally, so that gives us better access to warehouse pricing because we have bigger buying power. It also allows us to partner with other pharmacies across the nation. In times like COVID-19, that's been amazing because we can rely on them and vice versa for what they're doing, what's working well, what are they seeing in homes in other states as they're having outbreaks, how are they handling that. So we really appreciate that relationship, but outside of that, we don't use them. I mean, you'll never talk to anybody but Carol or myself or Rocky and our crew right here in Iowa. I don't talk to them a whole lot except when we need resources and things for them. So we get kind of that national power and that national resource, but we still get to operate locally. So you still get Iowa nice service, we like to say, because I think that's really important here. So that being said, I'm going to turn it over to Carol so that she can kind of walk you through the details.
Okay. So basically, really, all we're going to do today, you guys, is you're all nurses, so this really it's not rocket science what we're doing. You're just switching pharmacies. Your service will start with Rightos on June 1st. So up until then, everything is with your current pharmacy. And at this point, you should be double faxing all new orders to both Martin and Rightos. And that I want to just encourage you, if you happen to forget to fax Rightos the same day that you did it, you get home. If you're like me, sometimes you remember when you are at home and you think, dang, I forgot to fax Rightos. Just have someone do it, or if you're working the next day, do it then. We just need those orders so our lists stay current. So when we start filling medications, everything will be good to go. So June 1st, you're going to stay on 30-day bubbles, same as you are doing now. So a lot of this, what we're going to go through today, is just really form changes and maybe some process changes. We're just going to talk it through, and you guys feel free to holler out with any questions that you have, because I'm pretty good at forgetting things. And even on the bag that Kara was talking about, a Guardian Pharmacy, so this is what you'll see, the logo, Rightos, a Guardian Pharmacy. So if we happen to say that Guardian word, just know that that's we're under the umbrella of Guardian. So, and I always start with, I've never done an in-service with a mask on, so I fumble around. I've never done surgery with a mask either, so you'll have to excuse me. So I always start with this quote because I like it. So I probably, after 2 years, should probably switch to something else. Coming together is a beginning, keeping together is progress, working together is success. So what we're doing together, this is our beginning. We're coming together, we're gonna learn about each other. A few weeks, a few months down the road, we're gonna keep together is progress. Because let's just face it, there's gonna probably be a few bumps along the road that we're gonna work through. And then working together is success. I just really have always appreciated that quote. One of the big things for us at Right Dose is that we really want to encourage you. We want you to communicate with us. We want to hear from you. If you're having an issue, you don't understand what's going on, talk to Stacy, call the pharmacy. You'll have access, my email, my cell phone. You can call and ask pretty much anytime. We want to hear what's going on here. So as a part of the communication, this is really our contact list. It's not going to look really anything different. We could pass these around, really, make you get up and move. We want you to have access to the people that work in the area that you have a question about. So the email's on there for billing. The email's on there for medical records, if you should need that. I'll list all the pharmacist names, because sometimes you talk to a pharmacist, they say their name really fast, if you have to document who you talk to, there's your list that you can go by, so you know how to spell the names. And we try to keep that updated as quickly as we can. Looking to Right Dose also has a website that you might want to take a peek at sometime. It's just www.rightdosepharmacy.com. If you go there, there's bios on all the pharmacists, the hours, access to some of these forms too. So that's a good place to look at sometime in these next couple of weeks.
Is this something you're gonna recommend that we keep by the fax machine? Or
I
something
would
different?
plaster that wherever you want.
Okay.
Yep, we tell people you copy it, print it, copy it, and put it wherever you want. This other sheet here too is just what we call our hours of operation. Right Dose Pharmacy is a long-term care company. We are open 7 days a week, and you will get deliveries 7 days a week if you need them. Our address is on here. It's just another form of information, and I would post this in your nurse's station somewhere. The phone, the fax number, the on-call number, hours of operation, you can see it right there, Monday through Friday, 8 until 6, Saturdays 9 to 3, and then Sunday 10 to 2. But there always is a pharmacist on call, 24/7. So if you need someone at 3 a.m., you're gonna, have a new order or something like that, you need to talk to a pharmacist about, that's what they're there for. That's what is a part of their job, to answer the phone. Easy to get a hold of the pharmacist during the night. You are going to use the same number that you call during the day. You're going to get a message that says the pharmacy is now closed, and then it will prompt you through to press number 3, which is to reach the on-call pharmacist. So not a different number, still the same number. Pretty easy to get a hold of the on-call pharmacist. You also on there, it has an order cutoff time, which probably we should talk about a little bit more in detail. So you're going to get deliveries twice a day for your refills and new medications. And your deliveries are going to be around 2 p.m. and 6 p.m. So your order cutoff time is like 12:15 and 5:15. Okay? Give us at least 45 minutes. I'd say an hour, but 45 minutes is doable too, to get those out on that next run. If you send in a refill at, let's just say 6:30 in the evening, for those of you that work evenings, if you don't specifically say that you need that out tonight, it'll come out the next night. So trying to say, if you need that medication to come on that 6 o'clock delivery, you're gonna call. That means a call. Just say, hey, this is Carol at Prairie Vista. I know it's after our cutoff time, but I just got a new order. I need that to come out tonight so we can start it. Just tell us. Otherwise, our data people are gonna go by the set cutoff time. Otherwise, there'd be no structure anywhere.
Right.
It's not a big deal. We're happy to send it out. We just need to hear from you. I like to say you're the experts. You know what your residents need. We don't. So in the pharmacy world, they don't really think like nurses. It's kind everybody sends their refills in 2 to 3 days ahead of time. Sometimes we do, sometimes it just doesn't work that way. So things come up, it's healthcare, you know your residents. If you need that medication, you tell us, we'll get it out to you.
What if we get a new admission and the paperwork doesn't come? You know where I'm going with this. The paperwork doesn't come until 4:30 or something like that. We haven't gone through it yet, and can we just give you a call and say, hey,
Yep,
I'm working on this admission.
absolutely.
I'll send it to you as fast
soon
as
as
I
I
can
have
and have it processed to make sure everything's
Probably
good.
what they'll do is, after your other delivery goes out, they'll send
They'll
you a
send that
staff
out.
delivery later with those, because there's usually more than one home on those delivery routes, so they don't wanna hold it for everyone else, just like
Yeah.
they'll respectfully do for you too.
Exactly.
They'll manage that on the back end.
But there's no, those staff deliveries are yours, like you have to use those when you need them, we're not gonna charge you for them or not, and so that's how.
It's just a part of it.
Yeah.
Yep.
Okay.
And I would say even too, if you have new orders that come in at 4:30, 5 o'clock, even though you haven't gone through them, if you wanna just send them to the pharmacy, that they can at least look at them and see what we have in front of us, that's legit too. And then you can always call and say, okay, don't send this, or whatever.
Right.
It just gives them a little heads up,
Okay.
so,
Can
yeah.
you
good.
elaborate a
And I
little
did-
bit more on the 2
well-
PM and the 7 PM delivery time too?
Okay, yes, the question was the 2 PM and 6 o'clock delivery time. So twice a day deliveries, so that, you mean as far as cutoff?
No, as far as, that doesn't mean it's being delivered at 2 PM.
Right.
Correct, that means it should leave the pharmacy around 2 PM, so you can expect your delivery,
Sometime thereafter.
yes. I like how you think, so, it just depends on the day. The pharmacy is really just like what you guys do. Some days run really smoothly, some days they absolutely get killed with orders, just like you get killed with admissions some days and orders. We do our best to stay on time, and that's why we have those cutoff times, otherwise it'd just be willy-nilly all the time.
I would say though too, like, you'll
You
kind of
should-
get a feel for
yeah.
as we go, what time that delivery is usually gonna show up. If all of a sudden you find it's coming like consistently an hour or two later than you were expecting, let us know that too, so we can
Yeah.
look on our end and go, what the heck's up with this delivery? Is our driver
Right.
hold up at home? Is the driver going and getting coffee before he comes to you? Like, because I don't know what time they come to your building. So if it gets really off,
Yeah,
or
we wanna
it's
hear
like,
from
this
you.
doesn't seem right.
Well,
then it's
anytime
okay.
after 2:30, I think it's fine. It's just
Yeah.
between 2 and 2:30.
Yeah,
is not-
that's,
Yeah.
it's a good point, we just do not, they're not just gonna absolutely leave at 2 PM usually.
Yeah.
So they're not, and we don't really know how many people are ahead of you, or even if there are people ahead of you. So, but Kara's right, we wanna hear from you if there's any issues. And as we learn more about you, I mean, those things are adjustable.
Absolutely.
That's the communication piece. Yeah, we wanna do what works best for you guys. Okay, but you did hear me say that it's after the cutoff time, you need the med that you're gonna call, right? Okay, good. Okay, this one is after hours on call, just another sheet. How do you get a hold of the on-call pharmacist? Really important for those 2 to 10 people, and really, till 8 AM in the morning. It just spells out a little bit how to call the on-call pharmacist. I'm gonna start over here. Well, that's gonna confuse me, you have all these other ones, don't you? I'm good at
Just
confusing.
making sure you're awake.
Yeah, I'm good at confusing people. Okay, this next form, I just bring it to show you, it's a rule that, well, for your SNP, that there has to be a medication review within the first 24 hours. I pass this out just so you know what that is and not to get rid of it when it comes over the fax machine. You don't need to do anything with those. I mean, you don't need to, when you get an admission, those should automatically come to you, get faxed to you for your new admissions. When you see those, keep them, give them to Stacy, whoever's in charge of admissions, so they don't get lost and they get tagged with a residence chart. Because those are important, so you don't get tagged on reviews, right? So I just bring that so you can see what it looks like. This next form is one of my favorite forms. It's called the Pharmacist Fall Review. And I like it because I wish I'd had it when I was working. At the facility that I worked at. If you have a resident that all of a sudden is starting to get a little wobbly on their feet, they've had a few more falls maybe, and you're thinking, wonder what's going on, or the family asks you a question, have you noticed this? What are you gonna do about it? That's always my favorite question. What are you gonna do about it? This is something you can do about it. You can fill out, all you have to do is fill out this top part here, this first third, with the resident's name, all that basic information. fax it to the pharmacy, to the regular fax number. One of the pharmacists will take a look at their medication profile, and they will write down any recommendations that they may think are worth checking into, such as more labs, a decrease in dose, something's not working well together, all those type of things. They will fax this back, and there's a place there that they're gonna write their recommendations, or they're gonna check no recommendations to changes to current medication regime. If that's what they check there, then put it with the chart. It's proof that you have done something. But if there are recommendations, then you're gonna in turn send it to their primary physician, and they're gonna say, yes, I agree, draw those labs or whatever. They're gonna fax it back to you, and then you're gonna follow through. Or they could put, no, don't bring them into the office or something like that. But it gives you a plan of attack to start researching why someone may be a little wobbly on their feet. There's not a charge to do that. You just need to let us know. You probably need to let your B1 know that you did that too, maybe. So she has a clue. But I worked with people with disabilities, and some of them weren't great on their feet. And a lot of times the families, what are you gonna do about it? And it's like, I don't know. It's hard. So I thought, this is something that you can show that you actually are doing something about it. So we welcome you to use that. Okay, then into the nuts and bolts of everything. Refills, you're doing those through PCC. Correct? No? You do paper? Okay. So this is just our form. It's a refill form with our logo on it. The most important part of this form is the lower left-hand corner where it says quantity remaining. If you're out, you're out. Please put 0. And the reason why that's important is on the chance that there's been a run of that particular eye drop or whatever, we have cleared the shelf of what we have. If you have 0 there, we will know that we need to get that from another pharmacy and get that out to you. Because you put 0 there, it means you don't have any to give. And we don't want you to have missed doses any more than what you want them. So if you squeeze the last drop out, there isn't enough for the rest of the day or for next morning's dose, just put 0 there, not a big deal. If you don't put 0 there again, pharmacy is gonna think, you know what, we've got a day or 2 to get that medication out there because everybody phones in refills in advance. You may not get it that night, so important to do that. So it's fine with us at this point as we transition your creams and your eye drops, everything over to Right Dose. You can use the Martin little peel tab and put that on that sheet. We just want the information that you need a refill. And then as we refill, then you'll see the labels change to Right Dose. Don't get rid of any of your current PRNs on May 31st. Keep using those until they need to be refilled again. Your residents and families won't like having to pay for something that they already have. So keep using all those. Your cycle meds will turn over to Right Dose on June 1st. Everything else, we will switch over as you run out. Okay. This form is and this is optional, Stacy, I think we talked about this maybe a little bit. This is just a sample of our narcotic inventory sheet that comes with any of our controls. So this is totally up to you guys, whether you want to use this or not. You won't hurt our feelings if you say no. Because some people really like their form that they have. Others like this because you will get fresh count narc sheets, inventory sheets, every time you get a refill of that morphine or hydrocodone or whatever, with how many doses that we send. So you can let me know about that, what you think, and kind of go from there. That's kind of not a very pretty looking form because they only print as that medication is being refilled. So it comes with all the patient's information's on there, what it is, the patient, the doctor, how many tabs.
So this doesn't automatically come?
Yes,
It
it will.
But it doesn't have to. That's what
It
she's
doesn't
saying.
have to.
So we can automatically send it if that's what you want to use. If you've got a different form that you use, you can tell us to turn it off and we won't
Yeah.
send them. So that's your choice.
Yeah. And you can try it for a while and give it a whirl, and then in a month you say, you know what, we really think we wanna just use our other form, that's fine with us, just tell me. So, more things to think about. So any questions? You guys are supposed to be the question people. No?
I did have a question. There's so many forms, trying to keep them straight. Just refresh me again on this admission medication.
Yeah, but that's just the form that's gonna come for your new admissions for
You
skill.
guys will send that to us?
We will send that to you.
Okay,
Yep, I just like you to see it.
okay, so you'll send it to us?
Yeah, you don't have to request it or anything, that admission for your, for your.
Same with that dark sheet, we'll send it to you.
It comes with you.
With the dark script.
Yeah.
So you guys are aware of the 28-day eye drop thing,
Yes.
correct?
Mhm.
So if we order it, because, 28 days it's gonna expire, are you gonna say, well, insurance won't pay for it for a couple days?
They might. And I'm gonna kind of punt that one to the pharmacist consultant. I'm aware of that, yes. The last time I talked to Megan about that, she still was going with the 30. And technically, insurance should cover it when they're close to 80, I think it's 80 or 85% gone. They'll
Mhm.
authorize a refill.
Right.
So, do you have a lot of eye drops here?
Not a lot,
But
but
it
we
comes
wanna
up.
make sure, the residents are aware of what they're supposed to be getting,
Sure.
obviously.
Good for them.
And, if we have to tell them that we don't have it because your insurance won't pay for it, but the regulation is it's only good for 28 days, that's the loophole there, that's
It
the
is.
problem. It's very frustrating to the resident and to the nurse that has to deal with that.
Right.
So that's why I was asking.
Yeah. I'll follow up on that again just to see what they say about that. But typically, yeah, we're not gonna send what insurance isn't gonna pay for unless you tell us to. Again, that's where you guys are the experts. Most people don't like to get medications that aren't covered. So we're happy to send it. We just wanna make sure we have authorization to do so. Yeah, that 28-day rule, that's a hard one. It really is. Anything else, you guys? Okay, moving on to the e-kit, which is what this big red kit is. So this is what our e-kit looks like. This is just a dummy e-kit, you guys. You're gonna get one that's got a pretty label. It says Prairie Vista on there, expiration date, all that kind of stuff. This one I just haul around with me so you can kind of see the size and what it looks like. This would make more sense probably. So this is what it's come. It'll be delivered a day or two before we start services. It may come with your cycle meds, so we'll see, but it will be here by June 1. And so June 1, this is what you're gonna use. You do not use anything out of your other one. It will come with an inventory list, which looks like this. And when you open up this kit, there are 5 drawers, we call them drawers, that look like this. They will all come labeled with medication name on there and how many doses are in here, so and you're gonna go by the inventory list if you're to look for what you're looking for. So you don't have to search for the medication that you're looking for. So if you're looking for, let's say some amoxicillin, you're gonna see that it's in drawer 3. So it's pretty easy. You're just gonna open it up, pull out drawer 3, and you'll see amoxicillin on the little label on here, and you'll open it up and pull out the dose that you need to make that happen. Each one of these drawers will come with a green lock on it. Green always means go. Everything from the pharmacy comes out with a green tag. Everything that you return to us comes with a red tag. That tells us that what drawer you've been in. The biggest drawer is always on top. You can kind of see the size difference. Don't try to jam the third one down to the middle or whatever. It just doesn't work very well. And the second drawer down is always our NARC kit. Your NARC kit will come locked inside of this. Your fridge kit will come separate with a green lock on it that will go in your locked fridge. Okay? So, this will come, there'll be green locks on all the drawers and a green lock on the outside of here. And this is a flip top lid here. You're gonna find more, your red locks in here to use to lock it back up again. So you always wanna put a red lock on the drawer that you use and then one on the outer kit. That satisfies the double lock rule. The best part about our e-kit really is this binder that I'm gonna show you. Cause I love the binder. When they deliver the e-kit, you're gonna find a binder like this. We provide these to you. When you go through all these, you just say, hey, I need another binder, we'll send another one out to you. We'll send one for each e-kit. And I like this because it gives you a running record of who's been in your kit and when. You're going to, let's just say, tell me your name. Sierra, pretty. So Sierra's going to take something out of the e-kit. She's gonna fill out her form. There's nothing new here under the sun than what you're used to documenting on. The date, the resident, what you're taking, the doctor, how many pills you're taking, blah, 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 blah. She's filled it all out. She's done a great job. She's written really nicely. Everybody can read it. She's gonna fold this up, pull it off, and fax this to the pharmacy. This is really a huge, important step. If you don't fax this in, we have no idea you've been in the e-kit.
Does it tell you to do that on there? Right on the form?
Good question. It's got the fax number on here. Fax this slip to your main provider pharmacy for replacement. But if you don't fax this in and then you use a dose, and no one faxes it in, and all of a sudden Betty needs to go get some amoxicillin, there isn't any, and then everybody's mad at the pharmacy and we have no clue you've even been in it if no one faxes this. So I really try to stress that a little harder than what maybe I need to. Once Sierra's faxed it, it goes in this flip top lid. Done. That is the pharmacy, when it returns back in the pharmacy, they know to open that up and they're gonna, oh, amoxicillin. They're gonna look for that, pull that tray out, refill it, get it sent back out. Now, Schedule 2s, you always have to call the pharmacist to get permission to breach the e-kit. You're probably already doing that. No matter what time of day it is, you just gotta do it. Just say, Sierra, I need, have a new admission, or someone's in the process of dying, I need to get Roxanol out, whatever it is. They're gonna say, okay. And really, this is just a safeguard to you to cover yourself that you're getting a Schedule 2 out of the e-kit. It covers the pharmacy. Well, it's a rule that you have to do this anyway. But the reason for the rule, it covers your license, it covers the pharmacy license, because then they're gonna make sure we have a current order for you to dispense that Roxanol. If not, then we're gonna get one and follow through on that. So it's a protection for you, it's a protection for the pharmacy, and it just has to do it. It's a rule. So we wanna do everything the legal and ethical way. Any questions about that? I think I kind of skipped over this yellow part here. These all stay with the binder. So heaven forbid you have a diversion or your count is off or whatever. You don't even want to say that word. All of your slips are right here. You should be able to track it. Boom, 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 of who was in where.
So the only sad thing is that I will not get a copy now.
Ah.
So currently.
Well, you can have them make a copy.
That's true, but.
It makes another step. Yeah. Yeah.
But I do like that.
Yeah,
It's in chronological order. which is nice.
I was like, that was amazing who came up with that. Cause I had a little file, you get those and then I had to sit there and put them all in order. Wow, that makes really good sense. So, yeah, but you won't, if you're getting a copy.
What they have now is they take the white one, the yellow one, and give it to me. So I'm like,
Yeah,
it's just a symbol by itself.
sure.
Maybe you should tell them to make one that has a 3.
That
That would one have a white, a yellow, and a
I
pink.
guess, you know what?
I like to know when they're on the e-kit.
There's really, you're the boss of your place, so if you want to have them give you this yellow slip, it's not like the pharmacy police are gonna come after you. that's easier for you.
I bet.
So I'll just leave it there. You
I
can-
bet I could get it printed and triplicate all of it.
You make the big decisions. So anyway, but that, you'll get a binder like that, and that'll be with you, so. Okay, we do have a procedure too, how to use the e-kit, and Stacy has that in that binder. So if you wanna print that and put that with that too, that's good to go. But you guys act like you really are on top of all that, so we're not even gonna worry about it.
Do you have an example of the fridge one?
I have a list of what's in it. I don't, it's
Okay.
really, it's the same size as the small one.
Okay.
Yeah, it just looks like this, yep. And the inventory list is in that binder, of what's in there. So, always a good idea before you call a doctor to have an idea what's in your e-kit. So they order you, especially in the evenings or nights, so, take advantage of those inventory lists.
You guys, any questions or anything you
Yep.
want to see differently on the e-kits? Nothing, okay.
We'll work through that. Again, that's a communication thing too. If you're finding I feel like it's got a lot in there.
It's pretty robust.
It's pretty robust, but you never know. But we want to hear from you if there's something that you think needs to be added. The pharmacists get to make those questions, but I want to hear from you if there is. Okay, the next thing are just some more communication piece forms that are really important. I like to go over those. This one, I'm sure Martin already has something like this. It's our partial fill slip saying, yes, we realize we're only sending you 20 of the 40 or whatever. We'll send the next part with you, or on your next delivery when we get more in the pharmacy. So we're just, again, it's communication, just to let you know that we know we sent you a shorter amount than what the resident needs, and we will get that too just as soon as we have more in the pharmacy. And then if it comes all filled out, that's just what that looks like. And what you do with those afterwards, that's up to you guys, but you should see those. Hopefully not a lot.
Triplicate like that?
You won't get triple.
Okay.
Hopefully, you might see those more at the beginning of service as we learn how much you use and go through things. We have a fantastic gal that does the purchasing, and she'll be on top of it. But there is a learning curve, just like with everything else, so you might see those more at the beginning.
Okay.
These are 3 forms that you may see. Refill too soon. When you send in your refill sheet, you may get this. It will come, this one's all filled out for Donald Duck. It will say the resident's name, what the medication is. Too soon, it'll say when it can be sent out. If it is, you get one of these, we will automatically move it, the refill request, to the day that we can send it. So like this calcium, the dates are off here, but the next available fill date for this order is April 1. We will automatically move it to the date, the first day that insurance will cover it. We're just letting you know that that's why you don't have that medication. And again, if you feel like you can't wait that long, then you call us and authorize, hey, can you send out, if it's an expensive med, we may just need to send out two pills or something, whatever. Prior authorization required, that's another one we all love to hate. We're just saying, hey, we gotta jump through a few more hoops. It's not gonna be out for a day or two. We got it, you're just not gonna see it for a while. Clarification requested. Occasionally, this happens also, you guys, that the doctor, do we have anybody on? Okay. I just,
They couldn't hear us, so.
yeah. Every once in a while, there's not, a script isn't real readable, or the doctor forgets to put an amount on there. There are certain rules that a script has to have for it to be valid. So we're just saying, yes, we got your fax order. We're doing some work behind the scenes to make sure that we have this accurate in the pharmacy, and then we will send it out just as soon as that is done. If nothing else, I'd let you move around a little bit. So those, again, they're just communication forms. What you do with those afterwards, that's up to you. But really, because we know the day nurses, it's hard to remember everything until your next shift. So hang on to those until the medication probably is in. So the night nurse, the evening nurse isn't frustrated wondering where that med is. You from the pharmacy all the way here. So no one blames anybody. Okay. Go ahead, put more of those in there. Okay, anything else? Anything, questions about any of that? This is about as dry toast, isn't it? Gosh, I'm really into those NARC forms. These last couple of things all go with billing, which everybody that knows me knows I hate insurance. I just don't like it. I like it. I like it when it works well, but I don't like talking about it or thinking about it. So these forms are basically just so you're aware of them as you admit people. This is the responsible party guarantee. It probably is one of the most important forms for your new admissions, because this tells us where, unfortunately, our medications cost money, they must be paid for. We need this, it's so helpful if this is all filled out accurately right from the get-go. Where the bill goes to, if it's the resident, if it's a son, it's the daughter, do we have the right address? So we just really appreciate your help on the front end, getting that information accurately. Billing questions, you guys, if you get hit with those, which you will, it's a new pharmacy. A lot of times people are skeptical of pharmacies. We ask that you just email or call our pharmacy and ask for the billing department. Give that number to your family member, whoever it is that wants a better explanation. You guys be the nurses and let our billing department take care of those insurance questions. Trust me, they'll answer them better than any of us ever could, and they can explain it. So I just really encourage you, you be the nurse, let them be the billing people.
I will say, for those of you that work with AL, our new Easy Pay system is really wonderful, especially if you have families that are paying the bill. It's a paperless, they receive a statement, and assuming they have no issue with the statement, it just auto pays so many days after they've received their statement out of whoever's account that they've set up. So it takes some of that need to be so on top of it sort of off, and a lot of families, especially if they don't live here locally, the bills are coming in, they really prefer it. It's pretty seamless. We don't call it auto pay because it's not like we just take the money out. They do get a chance to review the bill first, but it is set up similar to an auto pay. We call it our Easy Pay. So I'll talk to, is it Kylie? I'll talk to her about that between now and, when we get you guys rolling. But a lot of families have really responded positively to that because it's taken some of the, if it gets mailed to the wrong place or it gets set aside, it's taken all that out of their hands. They don't have to worry about it so much.
So will this be part of the admission package?
You can copy it. We would love that.
So I'd give this to our social
You
worker
bet.
that does all the
Yep.
major admission. Okay.
Yep, and these other two, just so you're aware, we do.
And I'd love to talk to that person about Easy Pay as well.
Well, yes,
Too,
sure.
that would be great. Yeah.
We also do,
I'd be grateful, sorry.
That's all right. It's hard with a mask on, I don't see a mouth moving, so it's gonna, we have to work on our cues a little bit more. A credit card, we do credit cards and then automatic withdrawal, so it's nothing too exciting, but I like to show those. So yes, give them to your, we'd love it if you give them to your admission person. I did bring, oh yes, short cycle meds. Yes. Why do I always forget that? So, are you familiar with short cycle meds? Yes. Do you know when your short cycle your cycle starts?
I'll be honest, I don't think a lot of us are familiar, because I went around and asked a couple people, and they didn't have no idea what I was talking about.
Short cycle meds are medications that are, I always say CMS says you can only dispense 14 days worth. It's not a pharmacy thing. We don't even know, that list changes all the time. We have no control over that. So your frustration is our frustration, but Eliquis, levothyroxine, sometimes Lasix, which blows me away, and I forget some of the other ones. They're gonna be what we call short cycle meds. They're gonna come out on a card that looks like this. We haven't lost our minds, but this is just how it is. We need to find out for sure when your short cycle meds change over. So we can sync up to either a Wednesday. Right Dose does either a Wednesday or a Thursday. So we just need to know when yours ends so we can.
The one I saw was Friday, so.
So they should all be on the same schedule. Okay, so they flip over tomorrow. Okay. So they will come, short cycle meds will come out on a card looking like this. There will be a label on top here. And and I'll pass these out too, just so you can see what a bubble pack looks like, what a label looks like. And this is just a sample of our bubble for fewest cards. And I'm just gonna look at that just to remind myself, so. We're not gonna cycle any of your controls, your 3 through 5s. You're gonna refill those on demand, okay? And then in AL, we're gonna use fewest cards for your controls and then administration times and your skill. So this is an example, so this is what one of our fewest cards or fewest meds cards looks like.
And what does that mean, fewest med cards? Is it multiple
They're
medications
gonna
in a
pull,
card?
so if a resident is on, tramadol 50 milligrams 3 times a day, they're gonna pull all their doses from one card, instead of an 8 AM
Like
card,
a
a 4 PM card, and
60
PM card.
pills instead of.
Yeah, it's just
Okay.
easier for counting,
I get you,
90.
yeah,
I get you, okay.
yeah. So that's been set up. I just like to review it here, so everybody's aware. It doesn't make any difference to us, we just want everybody
Are
on
you
the
doing
same
those?
page. Pardon?
Are you doing those?
Fewest cards?
Or would you rather have the admin time? We can do whatever you want.
I'm gonna have the room on that soft part. I'm telling you now.
We have admin times for
We will have
SNP
enough room.
With admin times for SNF.
and fewest cards for AL.
Okay, yeah,
Yes,
yeah.
back right,
Keep it
yeah,
that way.
for sure.
Yeah, okay,
That's what,
So you want to keep it that way?
yeah.
You don't want to do that?
It'd be easier because we're full right now on our cart for what we have.
And then you start
And
pulling
then
it
you
on
start-
the wrong one.
Yep.
Like you'll
So
use
rather
the
wait?
morning.
My problem is if they change, something changes, you waste all that.
You return it. Yes, you can control, but control keys, but.
That's what I'm
insurance
talking about.
doesn't, yeah, insurance doesn't allow returns on partial returns. So
We're
if a
talking
card
about
has been used in any,
Perhaps.
if one pill is out of that bubble pack insurance,
Yeah.
there's no return on it.
That's what
If
I'm
you
saying.
get a bubble pack and that order, it's full, and that order changed before you get a chance to use it, you call me or email me, hold on to that card, and we'll work through that on a case-by-case basis. But any card that has a pill, 10 pills, 20 pills, if it's been used, it's not legal.
Yeah, that's what I mean.
You guys have, I've worked with you guys before, and you guys have made exceptions saying we have, BID med, and we've changed it to QID. I know that, like, I personally have, okay, the 2 o'clock run, I've handed it to you guys have said we can relabel it instead of wasting those. We hand it to you guys, and then you guys will send it back out for us. You guys have made, like, are you guys still doing that, exceptions, or you guys will relabel instead of
For sending them.
wasting?
Let me check on controls. We can repackage within the same facility for, I know the answer is yes for normal meds, but I don't have to double check on,
Yeah.
the rules for controls are always, I never want to see that.
Because I feel like, I just know that,
Yeah.
in
If we
a couple
because we can
instances,
even-
we have said.
You're so close, if we can get them back, repackage them, get them back out.
And we can even repack for you guys when they move local care
Right.
within your own building too. So if they move from ALF to SNF back to ALF, we
Yes.
repackage those meds for those residents
Yeah.
as well.
That's the
So,
beauty of having one pharmacy.
Yes.
And the issue with that, it isn't that we don't wanna do it, but it falls under nurses can't dispense. It's a pharmacist role. And labeling is part of that. That's where it gets a little gray. We can check, I think we'll check on that. It's a case-by-case thing. Probably just need to talk to the pharmacist.
Okay, so I just wanna make it clear. So if I have a resident who came from AL and they are skilled now from the hospital and they are being discharged back to AL, we send the cards back to you so you can relabel, and then that way that it'll be dispersed to them through you guys. Am I correct?
Yes.
If
So
they
they're
need
going
to be relabeled, I mean.
Yes, and rebuilt. So, you know, if they were only here for 10 days and we sent you 14 days worth of meds,
Yes.
we'll only charge you guys for 10 days. We'll transfer the billing for the next 4 days that go on with them back to whatever their insurance plan is. Does that make
Okay.
sense? So that you, skills not pay for 4 days for them when they're not there.
Okay, I get you. I just wanna make sure I'm clear
But
on
that is
that.
also why we need you to send them back, so that we can make sure that happens correctly from a billing standpoint and an insurance standpoint as well.
So how does that happen if they don't discharge until 3 or 4 in the afternoon and they have meds yet to be?
That's a great question.
I know.
So that's where I'm
I suppose
coming.
we just send the discharge meds. We send a full card for the discharge meds for that patient, and then when we receive your return, then we'll issue your return to the skilled. Does that make sense?
Okay,
So
yes,
they're not gonna get the exact same 4 pills back. We're just gonna make sure that from a billing standpoint,
The numbers
that
match.
you were credited those 4 pills, that their insurance picked the bill back up on the date that they went back to their insurance. Does that
so,
make sense?
yeah, so you
Because she'll send
automatically,
us the paperwork, right? We get the discharge paperwork from you,
Right.
that will let us know that they're leaving. So then
Exactly.
based on that date, that's how we'll adjust your billing. A new card will show up for them, because that's like an order, the
So-
discharge, right?
okay, so I want to make clear,
Yeah,
they're going back to AL. We notify you guys that they're going back to
Yeah.
AL. You're gonna be sending out to AL a
There.
whole new batch of
yes,
stuff. We do not give anything to AL.
no. And
They-
you'll just put those meds you have left for that patient in your
In the
return.
return?
bin, they'll come back to the pharmacy, we'll
And
take care of
they'll
it.
get credit.
Okay.
There'll be
Okay.
a little bit of a lag time there, but yeah.
So no,
Yeah.
we don't send them to,
No.
so keep going back and forth, keep it straight.
Yes. Don't
That's,
send them
that's
the
why
rest.
I wanted to make it perfectly clear so
Yes.
everybody understood what, I mean,
Okay,
I was
well, we got
picking it
that
up.
Yeah, it is
It just
confusing.
sounds like.
It is confusing.
All right, we will
So
do
I
our
got that
best.
big checklist again.
That's okay, you got this.
It's always the most complicated part.
It is, and
And no fault of anybody's, it's just, it is confusing, it's challenging, so.
okay.
Okay, so short cycle, let's start tomorrow morning, we talked about controls. We talked about the website, Right Dose has a Facebook page, we'd love you to follow us on that, because I follow all of you. It's fun to see what everybody's doing. You're continuing your double vaccine till the end of the month. As we get closer to the end of the month, and then I'll be done here, because I know I've talked a long time. So if you happen on May 30th, you get an order for 10 days of amoxicillin for somebody. You need to really make sure that Martin Health is clear that they should send the whole 10 days.
Right.
Don't get 2 days from them and finish up. Typically, the best practice, standard of practice is that they should send out the whole thing. But I would encourage you just to make sure that that's what's happening.
If they will not, in the
If
last
then you
couple of
tell
days.
us, we've had a few things pop up.
Yes, I'm just gonna say, yes.
You let us know.
So if in a couple of days leading up to the first, there's a couple where they either refuse to fill them, or they refuse to
Yeah.
send you more than a couple of days because they're done with service, call us.
Call us and we'll do it.
Even if it's the 27th or the
Yeah.
28th, so you can get the full 10 days
Yeah.
for us, so.
We're not gonna leave you hanging.
That's
so,
been happening more and more lately,
yeah.
it seems like, so.
It's just a good thing to keep in mind, because you're gonna fax us the order, but unless you tell us, the pharmacy is pretty much gonna assume that they're gonna send the whole 7 day or 10 days. So, we don't like surprises any more than you guys do.
What's your process for your delivery right now then, first,
COVID,
what we do?
Well, what would you
Yeah.
like your process to be? We're just kind of doing whatever the homes would like us to do, so. Some buildings, they don't know the building at all, they call when they get here, and someone meets them, gets the meds that way. Some have a
You
different.
don't, you're not doing like a special color bag or anything like that?
Yeah, so normally, in normal world, your bill, your.
I think it's in the binder,
Yeah.
this is
Your
our,
meds would come in totes, we're not using totes anymore, because we just can't keep up
Oh,
with
okay.
disinfecting. So your meds will arrive in paper bags, which you will just throw away. Returns that you need to send us, same, you can just throw them in a garbage bag or a regular bag, whatever works for you guys. Just know that there will be no totes involved for the foreseeable
Okay.
future, just to kind of keep.
yeah. So typically, they're just coming to the door, dropping off meds.
Yeah.
If you happen, and I am sure, if you happen to get a positive COVID test, we'd love it. Please let us know. Just, there's no judgment, there's just, we need to know if those keep our pharmacy drivers safe.
Yeah.
Well, right now, the health center entrance, they're coming in, but they're not coming, there's a little
Right.
entryway. They're not coming, the nurse is opening it and taking it, and then they're signing. So how do you guys sign the stuff?
They'll have a piece of paper at this point, it's basically a tracking form that they'll sign, just say, hey, that I accepted this delivery.
Okay, is it a carbon or is it just?
It's just there's two.
Two,
They'll
okay.
sign one, they'll give you one, we'll take one back to the pharmacy. And I try this comes up periodically too, it's basically a tracking form. If you call us occasionally it happens that maybe you'll say, when you go through the minutes, that maybe instead of 30 that we have you down for, we sent 28. Just call us and tell us.
Yeah.
We'll fix it. It happens periodically. But I would encourage you, narcotics are kind of a different thing. If you want to double check those, I get that. The rest of it is basically tracking. So if eye drops that we have that went through full workflow at the pharmacy, we have that were delivered here, Sierra signed them, but someone else calls in the morning and says, I can't find Evelyn's eye drops, we go in and we can say, well, they were delivered on, what is today, May 14th, Sierra signed for them, would you just look again? Maybe they went into the wrong drawer or room or whatever. If you can't, then we'll send out more. But it's basically a tracking thing. You're not signing your nursing license away. Eventually, the paper's gonna go away. We're gonna go to like a FedEx type thing where you're just signing, the phone. So that will be coming. COVID pushed that
I
way
know,
back.
it was like go live week and then COVID.
COVID happened. I mean, it was gonna happen. The person was there to do it and then, so
So we're back to paper for now.
yeah, we're back to paper.
Okay. Is it typically the same driver or third one?
Yes, you will have a consistent driver. I'm not saying we never have turnover, but you should get to know. And so you are welcome just to tell your driver how you want them to handle it. They've done a great job of keeping track of each home's policies and procedures and how they want them to handle that and where they want them to drop off. And so, yeah, so you'll get to know your person, so to speak. The only thing I think with all of this that's made delivery, we've had some challenges with e-kit exchanges, just because they're not gonna come in anymore and come in and find your e-kit and trade it out for you. And so we just ask that, when you need to trade it out, make sure that you have it out and ready for them, or if they ask for it, someone's available to go grab it for them quick. So, that's kind of, I think, the biggest headache for them in all of this, but yeah.
We'll send out a new e-kit, you send a slip in, we'll send a new e-kit out, but they will also just automatically swap them out periodically, bring them all back in, check it for expiration dates. So even though, now I know your name, so I'm just gonna use you now. So even though Marcy comes and Sierra's working and Marcy says, I'm here to, I need to swap out your e-kit, you're gonna go, I don't need one, ours has a green lock on it. I've had this happen too, and they refuse to take the new one. But there's a reason for it. We're swapping them, double checking them, make sure that everything's up to snuff. So always swap them out when the driver says that's what they need to do. They're doing what they're being told to do. So, okay, unless there's any other questions, you guys are ready to go. So,
How's the whole changeover gonna occur?
changeover, we have you down either for that Wednesday or Thursday, and I didn't bring my calendar with me. I will come and check in your cycle medications with somebody.
Do you know about the time?
I don't. What would you like? How many residents do you have?
What have we typically been doing? Right now we have 37.
37? Yeah. You tell me. I can come right at 1, 12:30, 1 o'clock, we'll go through them, or the morning.
What day of the week did you say?
I'm not sure if it's a Wednesday or a Thursday.
The 28th of Thursday.
Yeah, but I can't remember if we're doing the other one the day before or
We're
not.
going to Northridge on the 27th and here the 28th.
Okay, so it's a Thursday.
That's Dr. Round's day.
Yay!
Yeah, not right now, yeah.
Well, that's better, maybe, than,
Well, our Wednesday's better too, I'll just flip up those, I haven't told them.
yeah, we have.
So that's easy enough.
I don't want to do it on Friday, it's too close to the June 1st. So you think about it, we'll see you again on Saturday and then on Tuesday.
Well, you might not see me Saturday.
Oh, you're not coming?
Probably not.
Good for you.
We'll see.
Who's going to be in charge on Saturday now?
You are now,
That's
terrifying.
It is terrifying. Okay, no, but you guys can go. You signed in, right? You guys are ready to sprint. I don't blame you.
Any questions?
We're looking forward to working with you.